Hey, Dr. Bill, how are you this morning?
Hey, Robert, how are you, man?
I'm getting younger every day. How about yourself?
Yeah, I think I saw a clip of Benjamin Button last night.
That is you and me in a nutshell. Okay, you had a town hall yesterday, and you covered a myriad of topics. How did that go? Because I heard there was a little yelling and screaming and rude behavior. Is that legit?
I told somebody it was kind of like you're in the bathroom at LSU football stadium and they're scoring a touchdown on the field. Because it's kind of echoing that's going through. But actually, it was really good. I mean, of course, there were folks who were kind of, oh, my gosh, we hate Trump and we hate everything he's doing. And then there's a bunch of people who said, hey, you know, we got problems in this country. We need to work through them. And whenever somebody started to kind of agitate and speak out of turn, I would say, will you please mind being respectful so others can hear, and everybody would applaud. So it was good. First Amendment rights being exercised, diversity of opinion. I enjoyed it.
Dr. Bill, let's start with health care, the House version of the Obamacare repeal, if you will. What kind of changes are going to be made, or will you guys do something completely new that goes back to the House?
Well, I think, first let me just say, the House had to pass something in order to advance the process, and so I'm glad they passed something. That said, you know, when President Trump was running, he made kind of a contract with the voter. He said it over and over again. He wanted to lower premiums, care for pre-existing conditions, get rid of Obamacare mandate, and did I say lower premiums?
Mm-hmm.
And so under the House plan, premiums actually continue to rise. So the Senate hopefully can do something better. Now, as I look at it, if we take as our kind of primary goals, how do we lower premiums with something which passes the Jimmy Kimmel test, as I say? It's credible coverage. If you or your spouse or your child suddenly needs to have a lot of stuff done, does it cover that lots of stuff? And, of course, that would include pre-existing conditions. Then we've fulfilled Trump's contract with the voter. Now, we got to change it a little bit or maybe a lot bit to get it in shape so that it fulfills that contract. That's my goal.
Dr. Bill, pardon me, if you look at pre-existing conditions as the medical equivalent of giving somebody insurance, giving somebody car insurance after they wreck their car, and I've said to Mike Johnson, a couple of others, that's a lot of things, but it's really not insurance. How is that at all economically manageable?
First, pre-existing conditions pre-exist. And so imagine a young child gets type 1 diabetes, childhood onset diabetes, and now she's 35 years old. Well, she has diabetes, and that was pre-existing. What you're describing, I think, would be what if someone did not have insurance, gets in a car wreck, on the way to the hospital signs up. That's what we're trying to avoid. Totally agree with you. So it's better if you have that person paying premium before they get in a car wreck, and not just that person, but everyone like that person who might, by luck of the draw, be the next to get in the car wreck. We have a provision for that. When we base it on Medicare. When someone turns 65, they get a letter. They say, hey, you're on Medicare. Call us if you don't want it. It's auto-enrollment, if you will. What we do is we say, hey, listen, if somebody's eligible for getting one of these tax credits, that would be in the insurance pool. The state has the option to say, hey, you're enrolled unless you call us and tell you don't want to be. The credit would be enough for the premium, and they would be in the pool, and the cost of somebody getting a car wreck is now spread out over the many, but that one person who gets in the car wreck already has coverage.
Senator Cassidy, if you had to vote on the measure the House passed, the American Health Care Act, today, would you vote on it, yay or nay? And what's your biggest issue, as simple as you can put it, because I'm the moron in the room. What's your biggest issue with it?
Well, first, we won't be voting on it. So that will never come to we've already said that we're going to change it. But my biggest issue is we have to lower premiums and have credible coverage. And the American Health Care Act, actually premiums rise the first couple of years. They begin to fall later on, but they fall because coverage begins to erode. So I think we can do better than that bill. And I'm glad they passed it, had to get over to the Senate, but I think we can do better. and I'm looking forward to voting on a bill that does better.
There's a piece I saw on the internet this morning. You tell me if I'm right or wrong, and I hope you haven't already talked about this, that your proposal with Senator Susan Collins would actually let states retain the Obamacare in part. What does this article mean? Is this article on target? Is it wrong?
So what we do, we give states three options. You can either go with the system we call the better choice, giving folks tax credits that they can use for coverage if they're eligible, or the state can keep the status quo. They have to reimpose the Obamacare mandates and penalties, but if California wants to do what California wants to do, the federal government should not stop them from doing that. And I consider this the conservative states' rights position. Conservatives complain because Obamacare took all the power to Washington, D.C. Now, some complain because we give power back to the states. Nope. Conservatives say if California wants to do some foolish thing, let them do it. But they have the right to do it. And so we allow states to, if you will, repeal Obamacare in the state capital. If they want to reinstitute something, God bless them, they can do it. But the federal government shouldn't be going around telling states what they can't do anymore. They should go around telling states what they have to do.